Hi, my name's Simon. I'm one of the final year medical students. Can I just check your name and age, please?
Yeah, my name's Andrew and I'm 25.
Nice to meet you, Andrew. Today I'd like to take your blood pressure, so that will entail me taking this cuff, inflating it around your arm, feeling and listening to your pulse. Does that sound okay?
Yeah, that's fine.
It might be a little bit uncomfortable, but it shouldn't hurt.
That's alright.
Are you okay for me to go ahead?
Yeah.
Lovely. If you just pop your arm on the table, that's lovely. Fine. And I'm just going to feel your pulse now. That completes the procedure. Thank you very much, Andrew.
Thank you.
To complete the procedure, I would check the blood pressure in the patient's other arm. I would then record the results in the patient's notes.
I'm Debbie, and I'm the medical assistant, and I'd like to first verify your birth date with you.
Identify the patient, sanitize your hands, and explain in detail how to collect the specimen.
Getting a clean catch urine sample from you today, and so I want to get started. First, I need to know, are you circumcised?
Yes, I am.
Okay, so what we're going to do, I'm going to give you this kit, and it's got a cup in it, and it's got 3 clean wipes in it. And what I want you to do is go into the restroom and clean around your penis, starting from the inside out and in a circular motion. And with each one, you're going to take the wipe and clean around and then throw it away, and do that 2 other times. Then you're going to urinate into the toilet. And at midstream, you're going to actually collect the specimen in the cup. It would be nice if we had about a half a cup of urine.
Then instruct the patient to finish urinating in the toilet before putting the top on the container without touching the inside. If the male is not circumcised, tell him to pull back the foreskin of the penis and clean the tip of the penis using the 3 towelettes.
The inside of the cup or the cap. Okay, do you have any questions for me?
No, I don't.
Very good.
For a female patient, change your instructions to address gender differences.
Okay, I'm just going to give you this kit, and I need you to go into the restroom. And the important thing about this collection is that we really need to have it as clean as possible. Okay. So one of the things I'm going to ask you to do is to make sure you don't touch inside the cap.
Okay.
What you're going to do is you're going to spread your labia, and you're going to clean from front to back on each side. So once down, there are 3 different wipes in there.
Okay.
Instruct the patient to spread the labia and use one wipe to clean each side and the third wipe to clean the center, cleaning from front to back. Then begin urinating in the toilet. Stop and at midstream urinate in the cup. Then finish in the toilet and put the cap on without touching the inside.
And you've had some urine go into the toilet. At midstream, you're going to collect some urine in the cup. And again, put the cap on, but make sure that you're not touching the inside of the cap. And then you can just leave the urine in the bathroom for us.
Okay.
Do you have any questions for me?
No, I think that's good. That's good.
Okay, great. Thank you.
Thanks.
For this step 1, fill out the form. It is important to write the name, the OB, address, and the collection date. If you have any symptoms, you must fill out in the form. And next, it is important to label the sample bottle. Your form and your sample bottle must be matched. For this step 2, the preparation. Be sure to wash your hands thoroughly with water. Stool collection tips, things to consider. Urine should not mix with your sample. Also, talk to a public health nurse if you have a loose or watery stools. Place the plastic water around the film of the toilet. You can also use tape to secure. Make sure the toilet safe is down. And poop on the plastic wrap. For the step 3, the collection. You should use this or plastic to collect the sample too. The sample must be no longer than the size of the dime. And if you have a watery stool, you must have fill to the line. Place the sample stool to the bottle and make sure to secure it tightly. Keep the sample at room temperature. Do not refrigerate it or otherwise the medtech will set it. And dispose your waste and wash your hands again thoroughly with soap and alcohol. For the last step, the step 4, return the sample. Place the sample in the canister along with the fill-out form and bring it to the person who is designated to collect it. The medical laboratory staff will open your canister and they will be the one who will going to test it. Here are the things you need to do when you have the positive test results. You may be required to collect more stool samples. This is to make sure you are healthy when you handle food. Next, here are the common mistakes: requiring a new sample, the incorrect labeling, mismatched name, oversampling, delayed sample, sample taken while on antibiotics.